Hi everyone. So in this series of sexually transmitted infection, today's topic will be hepatitis A. So hepatitis A is an acute infection of the liver, and it is caused by fecal-oral transmission. And that can be through contaminated food or water, or through sexual transmission, especially in men who have sex with men. And hepatitis A is caused by hepatitis A virus, HAV, which is a small single-stranded RNA virus. The incubation period is 15 to 50 days, mean of 28 days. The symptoms of acute hepatitis, they start with lethargy, nausea, fever, and anorexia for a few days, and then jaundice, pale stools, and dark urine. It is usually asymptomatic in children and more severe illness in elderly and pregnant women, and it usually resolves in 1 month. As for the complications of hepatitis A, liver failure, which is a rare complication. The diagnosis of hepatitis A can be done through liver function test and through hepatitis A virus antibodies. In the liver function test, you'd find AST, ALT, and bilirubin elevated in cases of acute hepatitis, while the hepatitis A virus IgM antibodies would be present in cases of acute infection and persists for 3 to 6 months. There is also the hepatitis A virus total antibody count, which includes IgM, IgG, and IgA, and they are present in previous infection or vaccination. So the IgM1, it signifies an acute infection. We should also remember to exclude other causes of hepatitis, such as hepatitis B and C, in our investigations. The management of hepatitis A in cases of symptomatic hepatitis A is supportive care, while in cases of severe illness or clinical deterioration, hospitalization is required. Other important immediate management: we should advise no sexual contact during the acute illness and for at least 1 week after the onset of jaundice. And that has to do with the infectivity period that I'll talk about in a minute. The other important thing is contact tracing. We should trace back 50 days from onset of symptoms. Now, the infectivity period of hepatitis A starts 2 weeks before the onset of jaundice to 1 week after the onset of jaundice. That's why we advise no sexual contact for at least 1 week after the onset of jaundice. In cases of persons who have made contact with hepatitis A virus persons, we should offer passive immunization with human immunoglobulin within 2 weeks of exposure and commence active vaccination course. We should also provide patient with fact sheet, notify the state or territory health department, and comprehensive STI testing may be appropriate depending on the patient's history. As for follow-up, we should review in 1 week, which provides an opportunity to confirm contact tracing procedures have been undertaken or offer more contact tracing support, and if high risk or men who have sex with men, provide further sexual health education and prevention counseling. So that concludes this video. Thank you very much for watching. Please like this video, share it with your friends, and subscribe to my channel.